Prostate cancer is a very common malignancy. Almost everyone will know of a friend, a colleague, or a relative that's had prostate cancer. While this is a very common cancer, everyone is a little unique in terms of how they experience it. Today, the most common way that prostate cancer is diagnosed is simply by an elevated PSA. When you have an elevated PSA, consultation with your doctor or even a subspecialist is really important. Many men have met with a urologist. They may be referred to a radiation oncologist to do radiation treatments or a medical oncologist to pursue some medical treatment. One of the things that we pride ourselves in at Mayo Clinic is the ability to work across specialties. This is a team approach where we try to work through and find what the best approach is for each individual person, understanding their priorities and their risks. A new diagnosis of any cancer is scary, but remember that prostate cancer, even the most aggressive types of prostate cancer, tend to grow quite slowly. There's ample time to get a second opinion, to reach out before embarking upon any treatment. Surgery is a common treatment that's used for men when they're diagnosed with intermediate or higher risk prostate cancers. The prostate sits in a really intimate and delicate area. Things like urinary control and sexual function are critical to men as they're envisioning a life after they're done with treatment. We have surgeons that have done hundreds and thousands of each of these surgeries, and with that experience comes a certain degree of understanding of individual nuances that maybe aren't as standard as they otherwise would be. At a place like Mayo Clinic, there's many ways that we can treat your prostate cancer. And really, depending on your individual circumstances, we can do things like active surveillance or watching to see if this actually needs treatment. We can do focal therapy, using other types of energy to just destroy a portion of the prostate rather than the whole prostate itself. Surgical removal of the entire prostate, radiation to the prostate would also be a common treatment for prostate cancer. And then finally, there's options once prostate cancer has spread beyond the prostate that could include things like hormonal therapy, chemotherapy, and all of those things really come together at a place like Mayo Clinic where we have this collaborative nature and understanding where we're all on the same team, your team.